If you have type 2 diabetes or prediabetes, there are three supplements that could dramatically improve your blood sugar control, reduce your A1C, and help protect you from complications. And I'm not talking about some trendy wellness fad. I'm talking about research-backed supplements with dozens of clinical trials proving they work. Hi, I'm Willem Lee. I'm a registered dietitian and a certified diabetes care and education specialist. I also have my master's in nutrition science. And today I'm breaking down the exact three supplements that the research shows can make a real difference for people with type 2 diabetes. By the end of this video, you'll know exactly what to take, how much to take, and why these three work better than almost anything out there. So let's dive in. The first supplement every type 2 diabetic should consider is vitamin D. And this one is especially important if you live in a place with long winters or if you don't spend too much time outside. What does the research say? Well, multiple meta-analyses show that vitamin D supplementation can modestly improve A1C by about 0.3 percentage points, and it can also improve fasting blood sugar and insulin resistance, especially in people who are vitamin D deficient. The benefits are strongest in people who have low baseline vitamin D levels or higher baseline A1C. And so how does vitamin D work? Well, vitamin D plays a role in insulin secretion and insulin sensitivity. Your pancreas actually has vitamin D receptors, and when you're deficient in vitamin D, your pancreas doesn't secrete insulin as effectively. Vitamin D also helps reduce inflammation, which is a major driver of insulin resistance. Studies show that supplementing with vitamin D can lower inflammatory markers like CRP and TNF-alpha. You may be asking, should I get tested first? Ideally, yes. A simple blood test can tell you if you're low or deficient. But here's the thing, testing isn't always necessary, especially during the winter months when most people's vitamin D levels naturally drop. If you live in a northern climate, spend most of your time indoors, have darker skin, or are over 50, there's a very good chance you're low in vitamin D. In these cases, supplementing is a safe and reasonable option even without testing. But can't I just get vitamin D from food or sunlight? Well, vitamin D is found in very few foods, mainly fatty fish like salmon, fortified dairy, and egg yolks. And while your skin can make vitamin D from sunlight, that only works if you're getting direct sun exposure on a large portion of your skin for 10 to 30 minutes several times a week. And that's just not realistic for most people, especially in the winter. So for most people with type 2 diabetes, supplementation is a very practical way to maintain healthy levels. How much should you take? The research typically uses doses around 4,000 IU per day, and that's what tends to show the best results for blood sugar control. Some studies use even higher doses, up to 5,000 or 6,000 IU per day, especially for people who are deficient. I usually recommend starting with 2,000 to 4,000 IU per day, especially during those fall and winter months. If you get tested and you're very deficient, your doctor might recommend a higher dose initially to get your levels up faster. What about the side effects? Vitamin D is very safe at those doses. It's a fat-soluble vitamin, so it's possible to take too much over a long period of time, but that's rare and usually only happens with doses above 10,000 IU per day for several months. The most important thing is to take vitamin D with a meal that contains fat, because that will help with absorption. Now, I want to be clear, major organizations like the American Diabetes Association don't currently recommend routine vitamin D supplementation solely for blood sugar control unless you have a documented deficiency. But according to research, 1 billion people around the world have vitamin D deficiency, while 35% of adults in the US have vitamin D deficiency. So, the research is pretty compelling, especially if you're deficient or high risk of deficiency. And given how safe and inexpensive vitamin D is, I think it's a very reasonable addition to your routine, especially during the winter. Now, before we move on to supplement number 2, I want to give you something. Supplements are powerful, but they're just one tool in the toolbox. If you want a complete game plan for reversing insulin resistance naturally, I've put together a free checklist with the top 10 daily habits that actually work. To grab it, just comment the word checklist below in the comments, and I'll send it straight to you. It's completely free, and it's packed with actionable steps you can start today. All right, let's talk about supplement number 2. The second supplement every diabetic should consider taking is magnesium. And here's something that may surprise you. Studies estimate that up to 65% of people with type 2 diabetes are low or deficient in magnesium. That's a huge problem because magnesium plays a critical role in insulin signaling and glucose control. Multiple meta-analyses. These are studies that pull together data from dozens of randomized controlled trials show that magnesium supplementation can lower fasting blood sugar by about 0.2 to 0.6 millimoles per liter and modestly reduce A1C by around 0.2 to 0.7%. Magnesium also improves insulin resistance, which is measured by something called HOMA-IR. And some studies even show it can help lower blood pressure and improve cholesterol levels. So, how does magnesium work? Well, it's involved in over 300 enzymatic reactions in your body, and many of those are related to how your cells use glucose and respond to insulin. When you're low in magnesium, your cells become more insulin resistant. It's like trying to unlock a door with a rusty key. It just doesn't work as well. Supplementing with magnesium helps to restore that insulin sensitivity, and it also helps your muscles and liver take up glucose more efficiently. And you may be wondering, can I just get magnesium from food? Great question. Yes, magnesium is found in foods like leafy greens, nuts, seeds, whole grains, and legumes, and you should absolutely be eating those foods. But here's the reality. Even if you're eating a healthy diet, it can be really hard to get enough magnesium, especially if you have type 2 diabetes. Your kidneys may excrete more magnesium when your blood sugar is high, and certain medications like diuretics can deplete it even further. So, while food should always be your foundation, supplementation can help fill those gaps. How much should you take? Well, the research typically uses around 250 to 500 milligrams of elemental magnesium per day. I usually recommend starting with 275 milligrams taken before bed. Why before bed? Because magnesium also helps to calm your nervous system and improve sleep quality. And better sleep means better blood sugar control the next day. But not all magnesium is created equal. This is really important. The form of magnesium matters. Magnesium oxide, which is what you'll find in a lot of cheap supplements, is poorly absorbed and can cause digestive issues like diarrhea. The forms that are better absorbed and gentler on the stomach are magnesium citrate, magnesium glycinate, and magnesium gluconate. Now let's talk about side effects. Magnesium is very safe for most people. The main side effect is mild GI discomfort like bloating or loose stools, but that's usually only an issue with high doses or poorly absorbed forms like magnesium oxide. If you have kidney disease, you need to be careful with magnesium supplementation, so definitely talk to your doctor first. But for most people with type 2 diabetes, magnesium is a safe, effective, and often overlooked tool for improving blood sugar control. Okay, the third supplement every person with type 2 diabetes should consider is berberine. And if you've never heard of it, you're not alone. But you're about to understand why it's often called nature's metformin. So, berberine is a compound found in several plants, and it's been used in traditional Chinese medicine for centuries. But here's what makes it so powerful for blood sugar. Multiple studies show it can lower fasting blood sugar by about 0.5 to 0.6 per liter and modestly reduce A1C by around 0.22. That's comparable to what you'd see with metformin in some studies. Berberine works in a few different ways. First, it activates something called the AMPK pathway. Think of this as your cell's energy switch. When AMPK is activated, your cells become more sensitive to insulin, which means they can pull glucose out of your bloodstream more effectively. Second, berberine helps reduce how much glucose your liver produces. Your liver can actually make glucose on its own, and people with type 2 diabetes, it often makes too much. Berberine helps dial that back. And third, it appears to improve insulin secretion in a glucose-dependent way, which means it helps your pancreas release insulin when your blood sugar is high, but it doesn't cause dangerous lows. Now you may be wondering, can I just get it from food? Here's the thing, berberine is found in plants like golden seal and barberry, but you'd have to eat massive, unrealistic amounts to get a therapeutic dose. That's why supplementation is really the only practical way to get the benefits. If you're wondering how much to take, the research typically uses 1,000 to 1,500 milligrams per day, split into 2 to 3 doses. I usually recommend 600 milligrams in the morning with food and 600 milligrams at night with food. That gives you around-the-clock coverage. Now, here's where I want to be transparent with you. When I was researching berberine for our own clients, I kept running into the same problem. Most berberine supplements on the market either had inconsistent dosing, weren't third-party tested, or used very low-quality extracts that weren't well absorbed. So my team and I created our own, it's called Jade Berberine, and we formulated it very specifically to solve those problems. Each capsule has exactly 600 milligrams of high-quality berberine HCl, and it's third-party tested for purity and potency and created in an FDA-registered facility. I created it because I wanted something I could confidently recommend to my clients and to some of my family members who struggle with blood sugar control. Taking it with food helps us a lot. One important note, berberine can interact with certain medications, so if you're on multiple medications, please talk to your doctor before starting it. But overall, berberine is one of the most well-studied natural compounds for blood sugar control, and the evidence is very strong. All right, let's recap. The 3 supplements every person with type 2 diabetes should consider are number 1, vitamin D, about 2,000 IU per day, especially during the winter months. It improves A1C, reduces inflammation, and supports insulin secretion. Number 2, magnesium, 275 milligrams before bed, generally in the glycinate form. It improves insulin resistance, lowers blood sugar, and helps you sleep better. And number 3, berberine, 600 milligrams twice a day with food. It lowers blood sugar, improves insulin sensitivity, and works similarly to metformin in studies. Now, I want to emphasize something very important. Supplements are not a replacement for the fundamentals. You still need to focus on eating whole foods, moving your body, managing stress, and getting good sleep. Supplements are just one tool in the toolbox, but they're a powerful one when used correctly. And if you want the complete game plan, don't forget to grab the free checklist. Just comment checklist below, and I'll send you the top daily habits to reverse insulin resistance naturally. For berberine and magnesium, if you want the exact formulation I recommend, the ones that are third-party tested, properly dosed, and designed specifically for blood sugar control, you can find Jade Berberine and Jade Magnesium in our shop right below this video. I have my own mom taking berberine every day. Now, you may be wondering about side effects. Berberine is generally very safe. The most common side effects are mild digestive issues like bloating, gas, or diarrhea, and those usually go away after the first week or two. Again, we created them because we wanted something we could trust and confidently recommend to our clients, friends, and family. All right, that's it for today. If this video was helpful, give it a thumbs up and subscribe if you want more evidence-based nutrition and diabetes content. I'll see you in our next video. Take care.